HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. Technology is more sophisticated, equipment is custom-tailored, and post-operative care has progressed. Dr. Jonathan Rasouli, one of Staten Island University Hospital's leading neurosurgeons, discusses the positive changes in spine surgery. Give it a listen.
Hey, Staten Island. Welcome back to HealthWish. I have an amazing guest here today, Dr. Jonathan Rasouli, who's actually one of our spine surgeons and has been one of our most critical additions to Staten Island and the medical staff here over the last couple of years. Welcome.
Great to be here. Thank you.
You know, what makes somebody wake up one day and decide to be a spine surgeon? Tell me a little bit about your story, your path, how you got to this point in your career.
Yeah, absolutely. You know, just a little bit about me. I'm not necessarily from Staten Island, but I'm from the area. I grew up in North Jersey and in New York City for the most part, and I did most of my schooling and my training in the city as well too. I did my neurosurgery residency at Mount Sinai, and I did my spinal surgery fellowship at Cleveland Clinic. And early on in my medical school, I had an interest in doing something with my hands and helping people in a way that I thought was really fascinating to me. And I liked the idea of being in the OR, helping patients, in particular patients who had brain and spine problems, and just being able to be effective and improving their quality of life. And so I thought that spine surgery was something that kind of married both of those elements of like the finest, most microscopic surgeries to the biggest surgeries that you could ever imagine. And it was a marriage of both of those. I loved it. I thought it was great. And I kind of never looked back.
And spine surgery's progressed a lot, right? So even from the time that I was in medical school, which, you know, unfortunately that time keeps getting larger and larger. You know, I remember when I was a student that, you know, spine surgery, you know, there were fracture work where you were trying to save someone's spinal cord. And then there were, you know, people that had other issues that you were trying to actually get them relief of pain or something like that.
Yeah.
But a lot of the results, at least in that period, they weren't really great. It's really come a long way, yes? It's not the same thing as it was 15 or 20 years ago.
Totally. I'd say the biggest things, if I was going to kind of put my finger on the three top things that have changed the most in the past 15, 20 years, hands down has been the technology. What we're using now today is more sophisticated, more advanced than ever before in spine surgery. And we're doing these surgeries here in Staten Island as well too. The actual equipment has gotten much better. It's much more sophisticated. It's much more custom tailored to the patient's anatomy, to the problem they're having, whereas used to be just kind of one size fits all type of instrumentation. Now we have much more advanced instrumentation that's 3D printed, custom made for the patient's anatomy and the curvature of their spine. And we've seen direct improvements. And the last thing would just be our understanding of the post-operative care. What do we do after someone's done with surgery? And a lot of that has to do with rehabilitation and physical therapy and knowing what kinds of therapies these patients need and get them aggressively rehabilitated and back walking and back to the person they wanted to be than they were before the surgery. So I started residency in 2012, and it's amazing how much has changed since then. And it's not even that far away.
The days of, oh, we're going to pull this disc out, or, oh, we're going to put rods in this person, it's just totally different, right? Which it sounds like what you're saying is based upon someone's curvature, based upon what types of symptoms they have, based upon their anatomy, what their risk factors are, they could be having one of any number of different pathways that go forward.
100%. Another thing to add to that is I can't tell you how many patients come and see me in my office and are amazed that, you know, they ask me, oh, after I get spine surgery, how long am I supposed to be in bed for? Like 2 months, 3 months, 6 months? No, they are supposed to be walking the same day, which is shocking to them, you know?
Yeah, you know, it's interesting because I remember a time when if you looked at the data, the number of people that would actually get worse pain post-spine surgery was almost the same as the number of people that would get better, right? And that's changed so much really over the last decade where that really isn't the case anymore.
One of the things also has changed is our indications and our knowledge of spinal fusions. And that's really where the bulk of our understanding has come into play. It used to be that when somebody would come in with a problem of the spine, let's say they had really bad back pain, or they had really bad arthritis, or another name for that is stenosis. We used to do surgery to take pressure off the spine, the nerves, and we used to put in screws and rods or pins into the bones to stabilize them. And unfortunately, we didn't pay too much attention to the alignment of the spine when we did this. So a lot of these patients ultimately were fused in ways that were not physiologic, or their bodies didn't want to be in that state. So they developed all kinds of problems later on. So now that our knowledge has improved we have a better understanding of spinal fusions and the alignment of the spine, we have kind of gone in that direction to improve patient outcomes. And we're seeing that basically on a day-to-day basis.
That's fascinating. I honestly don't know anyone my age or older who hasn't had back pain at some point, right? It's just one of these, ubiquitous things that all of us at some point or another have, and then for a lot of people, and I'm sure for a couple people watching right now, there are folks that have had the back pain that, used to respond to Tylenol or to ibuprofen, and it really doesn't as much anymore. And no one just walks into your office and says, hey, let's go do back surgery. It's usually typically a process, and most people kind of follow through like a fairly similar pathway. What does that normally look like?
Not all back pain needs surgery. That's what I try to drill into the heads of my patients, that not everybody needs surgery. It's funny, a lot of people are very relieved to hear that. They come in very scared, oh, do I need surgery? For the vast majority of people, and I'm talking like 90% of people, most of their back pain can be treated with what we call conservative measures or medical management. So what's medical management? That is basically a combination of physical therapy that's targeted towards stretching of their legs, building their core strength, which almost certainly they have lost over time, which we kind of naturally do as we lose muscle mass. The other part of medical management is medications. There are a whole slew of new medications that have come out on the market that don't involve the use of opioids. Patients are usually very interested in hearing about this, so we try to get them started on the lowest, safest dose of a non-opioid medication to try to get them back on their feet and control their pain. In some cases, patients might need injections, and that's usually a steroid or a numbing medicine. 90% of people will get better with just that. A little bit of time, a little bit of reduction of their activities, physical therapy, pain management. Most people will get better. It's that small 10% that don't get better with that, or they initially get better and it kind of wears away, or they can't really tolerate some of the side effects of the medications they're on, that we start thinking about surgery for those patients. And the surgery is not, as you said, not one size fits all. It's something that really comes with a combination of talking to your spine surgeon, getting to understand them, what your preferences are, and see what makes the most sense to you.
Join us next time as we continue the conversation with Dr. Jonathan Rasouli. HealthWish wishes to thank our special guests, Dr. Brahim Ardolic and Dr. Jonathan Rasouli, recorded in the Learning Commons at Monsignor Farrell High School. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.